should I always use Socrates, MAFTOSA, SPIKES, and all these kind of mnemonics to try and get me through my medical exam roleplay? I'm Dr. Aman Arora from Arora Medical Education, and this video is all about why you do not need to always use these mnemonics to help you get through exams like PLAB 2, UKMLA, SCA, medical school finals, etc. Now, if you're wondering what is going on behind me, this is Tenerife Airport in Spain. It is now 11:55 p.m. We're supposed to have a flight back to Birmingham at around 1 a.m. It is delayed, and our flight is not going to be for another 3 or 4 hours. And you can see, looking at the terminal behind me, it is completely empty, it is deserted. And I thought I'd make a quick video because I'm awake and I'm alert. And I actually had a question come in from someone taking PLAB 2 saying, Dr. Aman, I've been told that I need to ask Socrates in every pain situation. Is this true? And I've had similar queries in the past about, do I always have to do MAFTOSA, for example? In a Breaking Bad news case, do I always need to use SPIKES? The mnemonic is quite a common one that people often tend to use. So I thought I'd do a quick video about why you do not need to do these in every single situation. Very quickly, Socrates, of course, for those of you who don't know, is when someone comes in with pain, you can do a Socrates history to try and work out a bit more about that pain. So site, origin, radiation, things that make it better, worse, etc. MAFTOSA is something that you can use in your more clinical cases, covering things like allergies, travel history, etc. Things that you're supposed to go through in every case. And then SPIKES, for those of you who don't know, is used in a Breaking Bad news case. Things like setting, things like empathy, just things to help you trigger. And that's just the point I want to start on. These are just things to aid you in a data gathering or a history taking. They are not mandatory things that you need to do to get marks, for example. Now, say for example you get somebody who comes in with a new episode of, I don't know, elbow pain or wrist pain or knee pain, and you're not quite sure, it's not obvious what might be going on. There, for example, something like Socrates is very useful because you're trying to work out possible differentials, you're trying to work out what it could be. Could it be A versus B? I've got a fairly good idea it's not C, D, or E, but how do I differentiate those two conditions? There are things like Socrates going through that pinpoint, question by question by question, may be useful because you're trying to work out what might be going on. If, however, you've got somebody with a known history of knee osteoarthritis and they come to you for a pain review and they've had this condition for, let's say, I don't know, 6-7 years, tried lots of different things, then do I need to go back and do a full Socrates history just because someone mentions the word pain? No. So you remember, you guys are doctors, clinicians, etc. You've done role-play exams, role-play scenarios many times. You don't need to go back to basics and do these things every single time just because someone mentions the word pain, because you think that this is an important thing that I need to do to get marks. It doesn't quite work like that. You have to use your judgment as to when these mnemonics, Socrates being the one that we're talking about right now, might help in a situation versus where it may not help in a situation, and where there may be other things that become more important in that case. Think about the knee osteoarthritis case. Sorry, announcement here, probably telling me that my flight is not going to be for a while it's finished. So in that knee OA case, for example, Socrates is not going to be useful, but there may be other issues that I'm supposed to spend my time in data gathering doing. Sorry, I just pause again. Maintain social distancing. That is not going to be a problem at the moment. As you can see, there's no one to be anywhere near around at the moment. Our whole family we've got a whole family of around 9 or 10 people over there, waiting patiently for an announcement to say that we're taking off. But yeah, so in that case of knee OA, my job is not to figure out what the knee pain is, it's to figure out other issues. Maybe they're struggling at home, for example. Maybe there's causing problems at work. Maybe they've got, I don't know, a marathon coming up and they're worried about their knee pain, or maybe they're just exhausted or depressed because their knee pain is stopping them from going out. Those things are much more important than just going through a Socrates tick by tick point of view. Sorry, not an announcement. Okay, then another one that's commonly talked about is MAFTOSA. Now it's worth going and have a look. We've got another video somewhere about what MAFTOSA is. Like I said, it's a tick box thing that you can think about in your clinical cases, thinking about things like allergies, travel history, like I talked about. Now, of course, allergies and travel history are important to think about in lots of different cases, but it doesn't mean that I need to do it in every single scenario where there's a clinical presentation coming up. Now, for example, if I'm thinking that I'm seeing somebody with a chest infection or maybe a cellulitis, and I'm thinking, at some stage I may need to be giving this person antibiotics, am I going to ask about allergies in the first half in data gathering? Yes. Why? Because I'm thinking already that I might need to prescribe in this situation, and therefore I'm getting ahead of the game by finding out about allergies, rather than when I'm about to do the prescription, oh, by the way, have you got any allergies? Or worse still, prescribe it and not ask about allergies at all. So in that case, A, in MAFTOSA, is a useful thing to do. Let's think about, say, travel history, because I mentioned it. If someone comes in with a 2-month history of a cough and fever, for example, is travel history important? Of course it is, because you're thinking about TB, etc. And therefore, if I don't ask that question, it's going to look like I haven't thought about that as a potential important question to ask, but almost a red flag in that case. However, if someone comes in with a 3-year history of, let's say, nail problems, do I need to ask a travel history? No. Does this sound like I'm doing it just for tick boxing if I say it? Yes. This is where the mnemonics sometimes gets you in the wrong space rather than helping you. See, so many times I see people do these kind of role plays and they do it by default. They go through MAFTOSA for every single scenario, and it just shows that, I'm doing things as a robotic nature. I'm doing things because I've been told I need to do them. I'm doing things because I'm being formulaic. I'm doing things because I just don't want to forget things, and that's not really the best impression to give off in a situation like this. So have these mnemonics in mind, but don't let them overtake your natural ability to gather data or do a clinical history. Now, the third one we talked about is spikes. Spikes, obviously, people talk a lot about in Breaking Bad news scenarios, and for those of you who have seen our videos and been on our academy and done our mocks, you'll know that we teach principles, and Breaking Bad news is no different. There are some principles to bear in mind. Now, spikes obviously tells you about a couple of key things that you should be thinking about in a Breaking Bad news case. For example, the setting. Of course, think about the setting. Is it the right environment? Can I make it a little bit easier? Do I have to think about things in a different way? Of course, things like empathy. How do you be empathetic in a Breaking Bad news situation? Of course, these are important things to think about, but it's not that in every single BBN scenario I must think about spikes and go through every single one to make sure that I get the marks, for example. It just doesn't work like that. And again, it sometimes takes you away from being in that zone with that person and being the clinician, the human being that you are, to try and relay that information in the best possible way for that person in particular at that time. And that's where sometimes spikes can get over you a little bit. And I've seen in role plays and mocks where people just get so fixated on going through spikes that they're not really focusing on the person in front of them. They're not really asking about things like eyes, understanding their mind, figuring out how do I break this news with this person as opposed to somebody else, etc. So these things are very useful. Don't get me wrong, to have things like SOCRATES, MAFTOSA, spikes in your mind is a very good thing. But what I'm trying to say is don't let them overrule your ability as a clinician. Don't let them overrule your ability to focus on that patient. Don't let them overrule your ability to be flexible in the questions that you ask. I really want to drill this home. We spend a lot of time teaching this when we do our academies and our mocks, because sometimes we just need to reinforce to people that you are clinicians, you know what you're doing. Yes, have these tools in your mind, but do not feel that you are held down by them. And if you miss one particular question of one particular mnemonic, you are going to, fail a station or miss a diagnosis or something like that. So trust your ability. We talk a lot about confidence and being the natural doctor that you are. Have these things in your mind for a bit of confidence. They're nice to fall back on when you're really not sure where you're going, but please don't feel that you have to rabbit or parrot them out every single time you come across a situation in a role-play scenario. It just doesn't need to be done. I really hope this helps. If you found this video of some value, please do like, please do subscribe, please do share it with at least one person that you think may find this video of some value. If we are meeting you for our academy courses for PLAB 2 or SCA or any other course that we're doing in the near future, I really hope that we can add more of this kind of thing in person when we meet you face to face. Good luck for the exam if it's coming up in the near future. You know the hashtag Campus will pass, hashtag I went with Aurora. Goodbye from empty Tenerife Airport with the tannoy person alongside me for company. I will see you very, very soon. Take care.